This medication is used to treat high blood pressure. Lowering high blood pressure helps prevent strokes, heart attacks, and kidney problems. Quinapril-Hydrochlorothiazide contains two medications, Quinapril and hydrochlorothiazide. Quinapril belongs to a class of drugs known as ACE inhibitors and works by relaxing blood vessels so blood can flow more easily. Hydrochlorothiazide belongs to a class of drugs known as diuretics or water pills, and it works by causing you to make more urine, helping your body get rid of extra salt and water. It is usually taken once a day, with or without food. It is important to take it at the same time each day. Talk to your doctor about the best time to take this medication for you. Before you start taking Quinapril-Hydrochlorothiazide, make sure to read the patient information leaflet provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily in the morning. It is best to take this medication at least 4 hours before your bedtime to avoid having to wake up to urinate during the night. The dosage of Quinapril-Hydrochlorothiazide is based on your medical condition and response to treatment. Take this medication regularly at the same time each day to get the most benefit from it, even if you feel well. It may take several weeks before you get the full benefit of this product. If you are also taking drugs to lower your cholesterol, make sure to take Quinapril-Hydrochlorothiazide at least 4 hours before or 4 to 6 hours after these medications. Consult your pharmacist for more information about any potential drug interactions. Remember to tell your doctor if your condition does not improve or if it gets worse. High blood pressure can often be asymptomatic, so it's important to keep track of your blood pressure readings and report any concerning changes to your doctor. As your body gets used to Quinapril-Hydrochlorothiazide, you may feel tired, have headaches, or feel dizzy or lightheaded. You may also experience a dry cough. If any of these effects last or get worse, make sure to tell your doctor or pharmacist right away. To reduce the risk of dizziness and lightheadedness, be sure to get up slowly when rising from a sitting or lying position. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to be aware that this medication may cause dehydration and electrolyte imbalance. If you experience symptoms such as extreme thirst, very dry mouth, muscle cramps or weakness, fast/slow/irregular heartbeat, confusion, or decreased urination, be sure to tell your doctor right away. Additionally, it's important to seek medical help immediately if you experience symptoms of liver damage, such as nausea or vomiting that doesn't stop, loss of appetite, stomach or abdominal pain, yellowing eyes or skin, or dark urine. Although it's rare, there is a possibility of a serious allergic reaction to this medication. If you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. If you're in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Narration: Quinapril-Hydrochlorothiazide is a medication that is used to treat high blood pressure. This combination product contains two medications, Quinapril and hydrochlorothiazide. Quinapril belongs to a class of drugs known as ACE inhibitors and works by relaxing blood vessels, while hydrochlorothiazide is a diuretic that helps your body get rid of extra salt and water. It is important to avoid using this medication during pregnancy as it can cause serious harm to an unborn baby. If you are taking this medication, it is important to use reliable forms of birth control to prevent pregnancy. If you are planning to become pregnant or think you may be pregnant, it is important to inform your doctor right away. The dosage of Quinapril-Hydrochlorothiazide will be determined by your doctor based on your medical condition and response to treatment. It is usually taken once daily, with or without food. It is best to take it at the same time each day to help you remember. This medication can help control your blood pressure, but it does not cure it. It is important to continue taking it even if you feel well. If you have any questions or concerns about this medication, be sure to talk to your doctor. Before taking Quinapril-Hydrochlorothiazide, it's important to let your doctor know if you have any allergies to Quinapril, hydrochlorothiazide, other ACE inhibitors, or thiazides. Make sure to talk to your pharmacist about any inactive ingredients that may cause allergic reactions. Also, inform your doctor about your medical history, especially if you have a history of allergic reactions, blood filtering procedures, gout, kidney or liver problems, dehydration, mineral imbalances, lupus, or skin cancer. This medication may cause dizziness, and using alcohol or marijuana can increase this effect. Avoid driving or using machinery until you can do so safely. Limit alcohol consumption and discuss marijuana use with your doctor. If you are planning to have surgery, make sure to inform your doctor about all the products you are currently using, including prescription drugs, non-prescription drugs, and herbal products. Be aware that severe sweating, diarrhea, or vomiting can increase the risk of dehydration. Drink plenty of fluids unless directed otherwise by your doctor. Quinapril-Hydrochlorothiazide may make you more sensitive to the sun and increase your risk for skin cancer. Limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. Notify your doctor if you experience sunburn, skin blisters, redness, or notice new or changed moles/skin lesions. This medication may affect your potassium levels, so consult your doctor before using potassium supplements or salt substitutes containing potassium. If you have diabetes, monitor your blood sugar regularly and inform your doctor of any changes. Older adults may be more sensitive to the side effects of this drug, especially changes in the amount of urine and dizziness. If you are pregnant or planning to become pregnant, it's important to discuss the risks and benefits of this medication with your doctor. Additionally, consult your doctor before breastfeeding while taking Quinapril-Hydrochlorothiazide. It's important to be aware of potential drug interactions with Quinapril-Hydrochlorothiazide. Some medications like aliskiren, dofetilide, lithium, and certain immune system weakening drugs may interact with this medication. Additionally, products containing magnesium, like certain antibiotics and thyroid medications, could interfere with the absorption of Quinapril-Hydrochlorothiazide. It's crucial to consult your doctor or pharmacist for guidance on timing your medications to avoid any interference. Certain products, like cough and cold medications and diet aids, may contain ingredients that could raise your blood pressure when used with Quinapril-Hydrochlorothiazide. It's important to inform your pharmacist about all the products you are using and ask for guidance on using them safely. If you are undergoing desensitization injections for bee/wasp sting allergy, it's essential to inform all your doctors about your use of Quinapril-Hydrochlorothiazide to prevent any serious reactions. Lastly, this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform all lab personnel and doctors about your use of Quinapril-Hydrochlorothiazide to ensure accurate test results. And as always, it's important to consult with your doctor or pharmacist for any concerns or questions related to your medication use. If you or someone else has taken too much Quinapril-Hydrochlorothiazide and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. Canadian residents can reach out to their provincial poison control center. Symptoms of overdose may include severe dizziness, weakness, and fainting. It's crucial to get help right away in these situations. It's important not to share this medication with others. To help this medication work better, making lifestyle changes such as exercising, quitting smoking, and following a low cholesterol/low-fat diet can be helpful. You should consult your doctor for more details. While taking this medication, it's important to have regular lab and medical tests, such as checking sodium and potassium levels, kidney function, and skin exams. Make sure to keep all medical and lab appointments and consult your doctor for more details. Regularly monitor your blood pressure and heart rate while taking this medication. You can learn how to check your own blood pressure and heart rate at home and share the results with your doctor. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take your next dose at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing Quinapril-Hydrochlorothiazide, make sure to keep it at room temperature, away from light and moisture. It's important not to store it in the bathroom and to keep it out of reach of children and pets. When you no longer need the medication or it has expired, it's important to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember not to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.